A practical nurse is caring for a client with diabetes who reports dizziness and sweating. What is the nurse's first action? A. Offer orange juice. B. Check the client's blood glucose level. C. Notify the physician. D. Encourage deep breathing. Answer, B. Assessing the blood glucose first provides data to determine if the symptoms are related to hypoglycemia before intervening. A client with COPD is on 2 liters per minute of oxygen. The nurse notes increasing confusion. What should the nurse do first? A. Increase oxygen to 4 liters per minute. B. Assess respiratory rate and effort. C. Notify respiratory therapy. D. Give a sedative. Answer, B. Confusion may indicate hypoxia or CO2 retention. Assessing respiration determines the next safe action. A practical nurse must reinforce teaching for a client with a new colostomy. Which statement shows understanding? A. I will empty the bag when it is 1/3 full. B. I can reuse the pouch for several weeks. C. I should clean the stoma with alcohol. D. I can remove the skin barrier daily. Answer, A. Emptying the pouch when it's 1/3 full prevents leaks and reduces skin irritation. When administering medications through a nasogastric tube, the nurse should A. Crush all medications together. B. Flush with water before and after each medication. C. Mix the medications with feeding formula. D. Skip flushing if patient has fluid restriction. Answer, B. Flushing before and after prevents tube blockage and ensures each medication is delivered safely. A client tells the nurse, I don't want any more treatment. What should the nurse do first? A. Ask the client to sign a refusal form immediately. B. Explore the client's understanding and feelings. C. Notify the healthcare provider. D. Inform the family. Answer, B. The nurse must assess the client's understanding and ensure informed decision-making before any documentation. Which of the following is a sign of fluid overload? A. Dry mouth. B. Weight loss. C. Crackles in lungs. D. Flat neck veins. Answer, C. Crackles indicate fluid accumulation in the lungs due to excess fluid volume. The nurse observes a colleague documenting care not provided. What is the most appropriate action? A. Ignore it. B. Report the incident to the nurse manager. C. Confront the colleague immediately in public. D. Tell other staff members. Answer, B. Reporting ensures accountability and maintains professional and ethical nursing standards. Which strategy helps prevent pressure injuries in an immobile client? A. Position changes every 2 hours. B. Use of soft pillows under heels only. C. Daily massage of reddened areas. D. Limit protein intake. Answer, A. Repositioning regularly promotes circulation and reduces pressure on bony prominences. The nurse notes a client's urine output is 250 milliliters in 8 hours. What is the appropriate action? A. Encourage oral fluids. B. Notify the nurse in charge. C. Document and continue to monitor. D. Offer a diuretic. Answer, B. Urine output less than 30 milliliters per hour indicates potential renal impairment and should be reported. A client receiving for potassium reports burning at the foresite. What should the nurse do first? A. Stop the infusion. B. Slow the rate. C. Reassure the client. D. Apply a warm compress. Answer, A. Burning indicates potential infiltration or vein irritation. Stopping the infusion prevents tissue damage. A nurse finds an elderly client on the floor. What is the first action? A. Help the client into bed. B. Assess for injury. C. Call the family. D. Report to the manager. Answer, B. Assessment for injury ensures immediate client safety before further steps are taken. What is the most appropriate intervention to promote sleep in an elderly client? A. Offer a caffeinated drink at bedtime. B. Encourage daytime naps. C. Maintain a consistent bedtime routine. D. Reduce physical activity. Answer: C. Consistent routines support natural circadian rhythms and improve sleep quality. Which action demonstrates cultural sensitivity? A. Assuming all clients follow similar beliefs. B. Asking the client about their health beliefs and practices. C. Avoiding discussion of cultural preferences. D. Using only English for all communication. Answer: B. Asking the client encourages respect, understanding, and individualized care. When assisting with wound care, which practice prevents cross-contamination? A. Using the same gloves for all wounds. B. Cleaning from most contaminated to least. C. Cleaning from least contaminated to most contaminated. D. Reusing wound dressings. Answer: C. Cleaning from least to most contaminated areas prevents spreading microorganisms. A client is prescribed furosemide. Which lab value must the nurse monitor? A. Sodium. B. Potassium. C. Calcium. D. Glucose. Answer: B. Furosemide causes potassium loss, requiring close monitoring to prevent cardiac complications. What should the nurse do if a client refuses to take medication? A. Hide the medication in food. B. Document refusal and notify the healthcare provider. C. Insist the client take it. D. Offer it later without documentation. Answer: B. Documentation and communication ensure ethical care and protect client autonomy. Which of the following is an early sign of hypoxia? A. Cyanosis. B. Confusion and restlessness. C. Bradycardia. D. Coma. Answer: B. Confusion and restlessness occur early due to decreased oxygen delivery to the brain. The nurse receives a client assignment including a new postoperative patient. What should be done first? A. Check the surgical site and vital signs. B. Read the care plan. C. Ask another nurse for details. D. Administer pain medication immediately. Answer: A. Initial postoperative assessment ensures patient stability and identifies complications early. Which of the following requires standard precautions? A. All patients, regardless of diagnosis. B. Only clients with known infections. C. Only during invasive procedures. D. Only when blood is visible. Answer: A. Standard precautions apply universally to reduce transmission of infectious agents. A nurse is delegating tasks to an unregulated care provider, UCP. Which task is appropriate? A. Administering oral medication. B. Monitoring for infusion rate. C. Assisting with ambulation after assessment. D. Changing a sterile dressing. Answer: C. Assisting with ambulation is within the UCP's role after the nurse assesses the client's stability. What is the best indicator that pain management is effective? A. Client reports decreased pain. B. Nurse observes calm behavior. C. Family states pain looks better. D. Medication time has passed. Answer: A. The client's self-report is the most reliable measure of pain relief. A client with pneumonia is producing thick sputum. What should the nurse encourage? A. Increased fluid intake. B. Limited coughing. C. Deep breathing only. D. Oxygen without fluids. Answer: A. Fluids help thin mucus, making it easier to expectorate and improve breathing. When taking a blood pressure reading, which error causes a falsely high result? A. Using a cuff that's too large. B. Arm positioned below heart level. C. Arm positioned above heart level. D. Deflating the cuff too quickly. Answer: B. An arm below heart level increases hydrostatic pressure, giving a falsely high reading. Which of the following indicates a need for further teaching about insulin? A. I will rotate injection sites. B. I'll store unopened vials in the refrigerator. C. I'll skip my insulin if I'm not eating. D. I'll carry glucose tablets with me. Answer, C. Skipping insulin may cause hyperglycemia. Insulin dosage should be adjusted per provider direction. What is the best approach when a client expresses anger toward the nurse? A. Ignore the client. B. Remain calm and allow expression of feelings. C. Tell the client to stop immediately. D. Leave without explanation. Answer, B. Staying calm and allowing the client to express emotions helps de-escalate and build trust.